I'm James Hebert. I'm really happy to be visiting with you virtually. I'm a professor of epidemiology at the University of South Carolina, and I've been in the business of looking at the relationship between diet and different health outcomes for about 4 decades now. My work has brought me to basically every continent on Earth except Antarctica, and we have published papers on our new invention, the dietary inflammatory index, based on over 200 different populations in 54 countries around the world. I wanted to talk today about 4 of my favorite foods. The first one is a really big category, leafy greens. I mean, you can do all kinds of things with leafy greens. They are incredibly delicious. They are packed with nutrients. They don't have a lot of calories for the amount of greens you're going to eat, and they combine really well with other things. The second category I wanted to talk about is watermelon. I love watermelon. I've loved watermelon my whole life. When I was a kid, we used to grow watermelons, even though they took a lot of room up in the garden. They are red in color as opposed to the green leafy vegetables. And what makes them red is lycopene and these other compounds that are both colorful and have really strong biological properties that will reduce chronic systemic inflammation and make you feel better while you're eating them, after you eat them, and will reduce chronic disease further down the line. Peaches are also very colorful. They typically are orange, and what causes them to be orange are these compounds that are also really good for health. They are anti-inflammatory, antioxidant, and will do all kinds of wonderful things in your body. They will make you feel better right now, and they'll make you feel better far into the future. And then the last category are blueberries. And I grew up around low bush blueberries, these really tiny ones. They're really flavorful. But also the one I've gotten used to eating the larger ones that we can grow, down here in the South, and they are really delicious. And they are really dark in color, which means that they are loaded with these phytochemicals that are good for health, that will help prevent oxidative damage, that will do all kinds of wonderful things. You can eat lots and lots of these foods because they're nutrient dense. They don't contain a lot of calories. They have a lot of nutrients in them. And basically, all of these, what we call micronutrients, vitamins and minerals and things called flavonoids and these polyphenol compounds, they're all anti-inflammatory. You can't find one that isn't. So, the list of foods that would be anti-inflammatory is literally thousands long. And each one of those foods contains up to thousands of different constituents or components. We've set up this false dichotomy where we think, in order to be healthy, we need to eat stuff that doesn't taste good and doesn't make us feel good right now. And that nothing could be farther from the truth. The reality is that which will make you feel better now, that will reduce arthritic pains and morning stiffness and all kinds of things of that nature, will also reduce the probability of getting chronic diseases and also having a really bad case of them and having a lot of disability. So it isn't like you're trading one against the other. It's like you're getting it all, And so these foods are naturally flavorful. They're delicious. They smell really good. They combine with one another really good. They combine with other things really good. We can talk about the other foods you can combine with these, but lots of things that people could use creatively, put together creatively. They'll make you feel better now.